Okay, the final topic that we're going to look at is child sexual exploitation material. Now, this is an emerging area in this area of research, and it's an emerging topic, but one that I think is probably going to be becoming more important over the next few years or so, purely because of the kind of advent of all of the technology advances that we've now got. Now, child sexual exploitation material is colloquially known as child pornography. Now, we don't use that phrase as clinicians. Typically, you will still see it used in the literature in this area, unfortunately. And this is essentially the phrase child pornography gives this material a level of credence that it just simply doesn't deserve. So we know about pornography and the kind of consensual nature of what goes on in pornography typically. So the reason that we use child sexual exploitation material is it very clearly delineates what we mean. So it's sexually exploitative material that involves children. Now, Hannah Merdian and colleagues, so Hannah's based at the University of Lincoln, have done a lot of work with individuals who have been convicted of CSEM offending. And what they've found is that there are three key dimensions to this type of offending behaviour, based around the dimension of offence drive, so what is actually motivating and what's the kind of core underpinning drive that's making people engage with this, and about offence motivation, what are the psychologies that maybe motivate the use of CSEM, and then there's a third dimension that's about the sociality of offending. We're going to look at each of those in turn. Now, in terms of offence drive, what we're really talking about is there a differentiation between people who are fantasy driven and contact driven? And it seems as though there is. So these two kind of types of perpetrator in relation to CSEM differ in terms of the function that this offending has for them. So fantasy driven offenders are driven by a predominant sexual attraction or by some kind of other psychological drive. So it could be a collecting behaviour, it could be absolutely anything that is psychological in nature. Contact driven offenders are those who use CSEM within the course of contact sexual offending against children. So they may use it as a way to relive a contact sexual offence that they've perpetrated. So they may take pictures or videos as they're committing a contact offence, and then they will use that for masturbation after the fact, for kind of reasons of reliving that event. Or they may use this kind of material as a way of grooming a child victim. So, for example, this use of CSEM would serve a function to either lead to or relive a contact sexual offence for contact driven perpetrators, and for everyone else we would classify those as fantasy driven if there's no interest in contact sexual offending. In terms of dimension 2, which is really in relation to offence motivations, really what we're looking at here is the why of why people do this. So it could be that some people just have a paedophilic motivation. They're sexually attracted to a particular age group, and CSEM gives them a way of it gives them an outlet for that sexual attraction. So they use CSEM because it's a preferred sexual outlet, and it gives them sexual gratification. Relatedly, there may be people who have a more generic deviant sexual interest or a more deviant kind of sexual appetite. So CSEM for these individuals will be part of a broader pattern of deviant pornography use. So they might have zoophilic pornography, so kind of pornography that involves animals. They might have violent pornography that they use. They could be using a range of different pornography styles and topics. So we might refer to these as the sexual omnivore. They will just consume any kind of sexual material in order to obtain sexual gratification. The difference between the first and the second motivation types is that for the first subtype, the paedophilic subtype, it's about a preferred sexual target. For the second, it's about a more generic pattern of deviant sexuality. The third motivation is financial, and we know that unfortunately CSEM does have a global market that lots of people can make quite a lot of money from. So CSEM is traded in this context for financial gain. It might be that some people have absolutely no sexual interest in CSEM at all, but they see it as a way to make money. The fourth motivation is simply classified as other. So it could be anything at all. It could be that people are curious, so they might not have a particular sexual interest, but they're curious as to what that kind of material is like. It could be that they're collecting and they're trying to finish a collection. You might see people with maybe higher levels of autistic traits in this subgroup. But essentially the other motivation is kind of a catch-all kind of category for anyone who doesn't fit into the specific or general sexual interest categories or the financial motivation category. In terms of the sociality of offending, it's a very straightforward distinction to make. Are people low network or high network? Do people use CSEM in a solitary way alone, typically for their own sexual interest? Or do they use CSEM in a kind of networked way where they're trading material, they might be selling material, they might be trying to get access to different material? Those kind of high network perpetrators maybe have more antisocial traits potentially because they are using it in a much more maybe devious or manipulative way. Okay, so what Merdian and colleagues have done is conceptualize this into a model that can also be used to delineate different treatment strategies. So for example, if someone is seen as being a contact-driven perpetrator who uses CSEM, then traditional sex offender assessment and treatment is probably the most appropriate route for them to go down in relation to their management. Now that's because they fit, from a psychological perspective, that standard kind of sexual offence perpetrator typology, or that profile. Where we get a differentiation from that standard route is within the fantasy-driven perpetrators. And even then we can delineate between people who are generally sexually deviant and paedophilically interested in CSEM. Now what that means is that they might go onto a generic kind of fantasy-driven assessment and treatment, but this is still related to sexual offending. So you might see people being referred to things like the Healthy Sex Program or something like that, something related to sexual interests, and trying to either change or reduce or help people to manage those sexual interests in a more pro-social way. For people who are financially motivated or motivated by other factors, then sex offender treatment probably isn't the way forward for them. Their offending through CSEM is not driven by any sexual motive at all. They're not driven because they want to commit a contact offence, and they're not driven by any sexual motivation, any sexual interest. They're more antisocial potentially. They might have financial difficulties, they might have emotional regulation or impulsivity issues. So therefore they may be better candidates for generic kind of criminal assessments in terms of antisociality or something like that. And this is where we get distinctions between the contact-driven, sex-driven guys, the fantasy-driven sexuality population, and then the kind of other non-sexual motivations. Whereas before, if we were just seeing people as either sex offenders or not, or fantasy-driven versus contact-driven, and then we'll give them specific kind of treatments, we wouldn't be necessarily addressing the core criminogenic needs for each individual person. And that's hopefully making sense in terms of how we can use some of these insights from Merdian and colleagues to properly understand the best ways to treat and subsequently manage CSEM perpetrators.